Let's bring in Dr. Isaac Bogoch. He's a member of Ontario's COVID-19 vaccine distribution task force and an infectious disease specialist. Dr. Bogoch, 3,519 new cases in Ontario. Your thoughts?
This is exactly what a post-holiday surge in cases looks like. This is it. This is exactly what people have been talking about for probably over a month, and here we are. You've got your healthcare system in many parts of the country stretched beyond capacity. You've got ICUs that are full. You've got rising case numbers, rising hospitalizations, rising deaths. You've got field hospitals that are being set up in many locations. This is clearly an emergency. It is not going to get better. It is probably going to get worse over the next couple of weeks. Hopefully we can get through this surge with the least amount of damage possible, and hopefully we never have to go through anything like this ever again.
All right, but we're in the throes of it right now, right? And we have the Premier of Ontario saying, and I quote, "We're working around the clock. We're making sure we get everyone vaccinated." 15,000 vaccinations yesterday is what Premier Ford pointed out. It needs to be more and it needs to step up. Is that what you would say, or are you satisfied with the progress that Ontario is making thus far?
I'm quite frankly not satisfied until everyone in the province who wants a vaccine has access to a vaccine. I think it's obviously a good news story that there's a rise in rates of vaccination. That's certainly positive, but it's way too early to pat anyone on the back to say job well done. We still have to vaccinate all of long-term care and all of the retirement homes in the province on a very urgent basis. I know there has been a deadline set for January 21st for the 4 hotspots. I think that's great to have a deadline, but we should definitely be exceeding that goal and expanding it throughout the entire province. And then, of course, supply, I agree with him, supply should be the limiting issue. Supply from the federal government should be the limiting issue. We've got to mobilize these vaccines as quickly as possible. Definitely good signs that this is ramping up. That's definitely positive news. And I think I'm happy to acknowledge that, but let's set the sights on a much bigger target. Let's get all of the highest of high-risk people vaccinated and keep knocking on the door of the federal government for more supply.
All right, real quick, Dr. Bogoch, Quebec's curfew kicks in Saturday. What do you think of that?
When we're in a situation like this, I think all cards are on the table. All options are on the table to at least do anything to reduce transmission given the current state that we're in. Please, we can't lose focus of figuring out and addressing the drivers of the infection in the community, the upstream causes of infection. All these measures, while they might provide incremental health and safety and help, we've got to deal with the upstream drivers of infection. Okay. Otherwise, this is just a Band-Aid solution.
All right, infectious disease specialist Dr. Isaac Bogoch, always a lot to consider and digest when we have you on. Thank you for this, sir.
Have a good one.